Sport. As Australians, we immerse ourselves in it. We live and breathe sport. As children, we look up to many of the sporting icons and aspire to be just like them when we grow up. Little do we know that many of our icons use performance-enhancing drugs to achieve success. Some of these athletes include Lance Armstrong, Tyson Gay, and Alex Rodriguez. Performance-enhancing drugs, or PEDs for short, are substances that have the ability to drastically alter the human body and biological functions and are taken to benefit sports performance through increasing power, strength, speed, or endurance. These substances are extremely dangerous and even deadly. Even though this information can be easily found online, the benefits obviously outweigh the risk for these athletes. There are many kinds of PEDs, some of the most commonly known kinds being stimulants, narcotics, and anabolic steroids. Some of the less well-known PEDs include peptide hormones and diuretics. The varying kinds of PEDs have different effects. Stimulants are drugs that boost bodily functions, including heart rate and brain activity. They also have the effect of increasing happiness, energy, attention, opened or easier breathing, and suppress appetite. Although they come with these extremely appealing positives, there are negatives that occur as a result of taking this substance. These include serious long-term effects, such as stroke, seizure, and muscle deterioration. Narcotics are painkillers that are used to control pain from injuries and allow athletes to train longer. They provide the athlete with pain relief, feelings of euphoria, and sedation. Once again, these substances have negative consequences. These include physical dependence and addiction, nausea and vomiting, liver damage, and brain damage. Anabolic steroids are substances that stimulate muscle growth and can allow athletes to train harder and recover more quickly. Although they have the physical effects of heart attack or stroke, liver or kidney tumours, and blood clots. They also have the psychological effects of explosive aggressive behaviour, significant mood swings, hallucinations, and delusions. Peptide hormones, on the other hand, are naturally occurring hormones that circulate in the blood and can improve muscle growth, change the balance of other hormones, and increase the production of red blood cells, which increases oxygen delivery. These substances also provide improvements in well-being and improvement in sleep quality. This particular drug doesn't have as many of the larger health risks associated, although there are still some side effects. These include extreme kidney pain, joint pain, weight loss or gain, and decreased fertility. Diuretics are not exactly performance-enhancing drugs. They serve another purpose. These substances are used to get rid of traces of other drugs. They increase the production of urine, although they can be used as a weight loss method also. Even though they might not be a PED, they still have risks associated with taking them. The risks include dizziness, muscle cramps, allergic reaction, kidney failure, and irregular heartbeat. These performance-enhancing drugs have large impacts on each of the athletes, not only the physical element, but also mentally and possibly on their careers and reputations, if caught abusing them. Based upon the fact that PEDs are currently banned in sport, this has large consequences of athletes who get caught using them. If caught, they may be banned for a period of time, their sponsorships may be stripped, and their reputations as a sporting star and someone children look up to will also be ruined. After taking into consideration all of these health risks and career risks, athletes would surely make the decision to stay clean. Although there are greater factors than these that can persuade athletes to make the decision to take these particular substances. These factors include enormous pressure to perform and excel in competition, money and fame, shortcut to goals, peer and support team pressure, and culture of drug use in sport. Based off of the information shown, it is evident that a lot of factors that athletes have to take into consideration before taking performance-enhancing drugs, as each kind of drug has a greater effect than just the physical and mental aspect. These drugs can change the athlete's whole world, hence why we should encourage smart choices in relation to performance-enhancing drugs.